Welcome to Learn and Smile, the place where you take charge of your health and embrace more happiness in life, with experts bringing you the best and the most accurate knowledge about health and wellness. Learn and Smile is an IOH initiative to empower people and societies with knowledge that changes lives and lifestyles. Lifestyles that make you smile and connect to your core being. Webinars and knowledge hack videos are the key to this process of knowledge sharing. It gives us immense joy to learn together with you. So enjoy learning and keep smiling.
Our speaker is Ms. Annie Alexander. Ms. Annie Alexander is a PhD scholar and a counseling psychologist at StJohn's Research Institute, Bangalore. She does some amazing work helping people navigate extremely tough mental, emotional challenges in life, drawing upon her deep expertise and rich experience in this area. Today, Annie will talk to us about vital issues related to mental health and cancer prevention. Annie, it's a fantastic to have you as a speaker for our webinar to cover such a critical aspect, as Dr. Regina mentioned, like mental health, that is a huge significance when it comes to cancer prevention and care. So over to you, Annie.
Thank you. Can I share my screen now? Okay. First and foremost, I would like to thank the organizer for giving me the opportunity to talk on mental health and breast cancer prevention, which is a very unique and novel idea because people only look when the illness happens, then they think about the mental health, that to later stage of their life. So thank you again. Before getting into the topic, I would like to tell you what exactly I do, so that based on my experience, I'm going to talk about mental health issue with prevention of breast cancer. I've been working in a study, which is a longitudinal study for which where I'm looking at the breast cancer patients' psychosocial and cultural issues occurs at the time of diagnosis, during the treatment, and post-treatment. So we have a breast cancer support group which was functioning well. It's this particular cohort. I mean, the study ran for almost 9 years, and mainly we could stay in touch with the patient for over 9 years, just with only 2% loss to follow. So that this outcome data really helps in understanding the approach toward the cancer illness. So now I would like to talk about in mental health about the stress, because mental health as a spectrum of emotional issue, but stress is what is associated with cancer as per the research has been proved. Depression and other things are existing, but I thought the stress is what very common in with every human beings experiences it. So what is stress? In a simple word to say, it is a feeling of emotional and a physical tension in oneself. So when you see what is stressor now? A stressor is nothing but which causes the stress. For example, it could be a new job or a new marriage, which involves lot of multidimensional issues involved with that. So what exactly happens is when there is a stress, there is a two-way of we response to the stress. That is, it could be, if you could cope better, then you call it as eustress. If you are unable to cope with the stress better, you call it as distress. For example, again, I would take it as interview. If there is a job interview, what happens when one person is attending an interview and is able to do well in the interview and get through the interview, then the person experiences a satisfaction, a success, a feeling of accomplishment. However, a person couldn't do well in the interview and it was quite challenging for them. Then they experience the outcome would be about failure, feeling sad. So these are the outcomes exist in a stress. So today we will focus on how we can work upon the distress. So there are two levels of prevention of distress, that is primary prevention and secondary level of prevention, which I would be talking later in my talk. So now let me get back to the stress. So stress is of two types, which we all know, acute stress and chronic stress. Acute stress is nothing but a flight or a fight movement. If you see here, this woman is late to the job and she's, I'm sure her heart rate would be high and her eyes are widely open and she would be sweating. However, chronic stress is which this episode of acute stress keep repeating and there are other multiple dimensions involved into it. You can see this woman in the picture where she's overworked or so that it might lead into dissatisfaction of the job, and this can lead into a chronic stress. So today I would like to focus on the chronic stress because that's what it has an impact on the overall well-being of a person. See, as I explained to you, the job is under chronic stress, and other things could be a toxic relationship or financial crisis, health issue, loss of a loved one. And another most important thing we forget is caregiving is another important stress, chronic stress. Most of my patients at the time of the diagnosis, they do say that at least in the last 5 years of the occurring of breast cancer to them, they would have experienced one of this kind of a stress in their life. So let's look how, the association between cancer and stress works together. As Dr. actually Rakesh has told about, breast cancer is an hormonal illness. So what happens in a chronic stress, there is, you do expose to the hormones. So that would promote to the growth of cancer growth. And also, secondly, your immunity drops down. That is that as an association with the cancer cell growing. That is because our body is always scanning for those cancer cells. And once your immunity is low, it is unable to do that activity. So that's when your risk of cancer becomes high. And secondly, it also associates with the inflammation. Inflammation has a high risk to cancer. So these three aspects are physiological, but there is something called as behavioral aspect, which is also involved with cancer, which the previous speakers have been mentioned about dietary, exercise, and intake of alcohol. So when you're stressed, there is a coping mechanism. So many of them tend to have a coping mechanism of consuming more alcohol, smoking, overeating, and not going for exercise, not moving, sitting at one place, which all is a direct link to the cause of the cancer. So as we try to understand what is stress, how it is associated to cancer, let's now look into how we can manage the stress. So I see it is at this point, it is important to focus on self-care. That is, body and mind connection is what is important. See, the primary, as I mentioned to you in your previous slides, that primary prevention is required. One of the primary prevention is being aware of your thoughts and emotion. First and foremost, we are not aware of our thoughts. Next, we might be ignorant. Third, we might be very scared to look into our thoughts and emotion because it might make us feel vulnerable. But that all has an impact on your health. What are the ways? A simple form could be, you can share your thoughts and emotions to the person whom you trust or who is non-judgmental. You could not find someone, you can maintain a journal, talk about that event, what has happened, write down your feelings, write down your emotions, and write down your thoughts on this particular event, which will help you to catharsize the event, so that you would release manually, help you to calm you down. Suppose neither of them didn't work, it is better to seek a professional help, because a chronic stress will always lead to anxiety, and that can lead into an anxiety disorder. So some things would be out of our control in our hand, then you should really seek a professional help. Here I would like to mention, as a mental health professional, a profession, that many people have stigma to meet a psychiatrist or a psychologist due to our culture. But see, how our body gets tired and sick, you to go meet a doctor, our mind also gets tired. So you need help. So you need to seek at that time. Secondly, the primary level of intervention is resolving conflicts. So in a relationship, always there would be ups and downs. What it really helps is, the key aspect is effective communication. First and foremost, listen to the other person so that you will understand what is the perspective of the other person. And then have a effective communication by taking a middle path, neither being passive nor being aggressive. Say your point as it is, so that it helps both the parties. Now we come to the secondary level of prevention, which is relaxation. In our busy time, I'm sure many of them don't have time for the relaxation, which involves many aspects. So the first thing I would take it up is meditation. In meditation, I would like to talk about mindfulness. Mindfulness meditation is nothing but focusing on the present. It is basically anchored to your breathing. It focuses on your breathing, so that based on your breathing, inhaling and exhaling, it helps you to understand your body sensation, and that gives you more focus and attention to oneself. uh, because of this activity, what happens is it deactivates your sympathetic nervous system. However, in stress, that activates the sympathetic nervous system, and it all leads to many other physiological and psychological changes. However, reverse this act. See, mindfulness is not only just about doing a meditation of sitting somewhere quiet and focusing on your breathing. It also involves being mindful when you're cooking. Uh, you will look into the texture of the menu. Then you look into the color. Then you observe the smell. You taste. You also look into the process of the cooking taking place. That itself is a mindfulness activity. Another simple activity could be when you're going to shower. I'm sure we all go to shower thinking what to do next, what has happened to us previously, right? But have we ever thought that we are taking bath, we are scrubbing our head, or we are cleaning our body? Not really. We are too busy only thinking about our future or our past. But when you engage in this kind of activity, you tend to are more focused. With that, what happens? You release healthy, happy hormones. That is, endorphin is being released, so that you feel good about yourself, and your body and mind is more connected, and it is more healthy. The other aspects are like yoga. Yoga is also called as movement meditation, because of its postures and breathing focusing on. You can also take long walks, which will help you to conceptualize the problem better. Next is sleeping well, as Dr. Rakesh already mentioned about it. See, it's important to sleep 7 to 8 hours every day. While sleeping, it just not only your body is getting healed, your mind is getting healed. So give importance to sleep. If you have insomnia, follow the sleep hygiene. Take a professional help regarding that. Next most important aspect, and it is my favorite too, which is spirituality. Because see, many of the stressors are unexplainable, especially like loss of a loved one or a illness, which you can take it to the, to reason it out, you can take it to the philosophical level, so that the acceptance of the, stressor will be easier and coping would be better for you. And the last one is social interaction. Meet people, talk to them. We are becoming more and more narrowed people with our gadgets and internet network era. It is important for us to meet them. What happens again there when you meet your loved ones and you spend time? Again, you release an happy hormone, that is oxytocin is being released. So when you could relax yourself better, you will never let a stress lead into chronic stress level. I did talk about all the aspects on what is stress, what it causes, how are the, what are the ways you can implement by yourself to make you feel better. Uh, it is important that you bring the change in oneself. Because today's talk can be about how you can, uh, what are the changes you can bring, but you have to implement. So there are stages. I will just run through it. First and foremost, we are not aware of our stress. So tend to, contemplate on it and start thinking what you need to change and prepare yourself. For example, if you feel you need to go for a walk, set an alarm and prepare yourself for that and get into an action. Wake up in the morning, go for a walk, and that's where you actually reached there. And maintain whatever the aspect. It could be diet, it could be exercise, it could be meditation. It is all related to maintaining it. In fact, Dr. Rakesh did say about self-breast examination on the 7th day of your periods. You have to do it. Might be today you heard, you might do it this month, the following month. Afterwards, you might forget. But no, it has to be a continuous process. That's when you bring the change in yourself in overall being. Okay, so now I thought of having a activity on mindfulness, so that you people understand what exactly is this, because I've been talking, it is very important. Scientifically, it is proven as it helps in overall well-being of a person. So I thought of just having a mindfulness meditation session for just for 5 minutes. So if you all can sit up straight, that would be great. And keep your legs on the floor down, uncross your leg. If possible, keep your hands just flowing to your lap like this, so that just as if you're falling. And I'm sure you would have had a stressful day. End of the day, you can relax for a while and you are worth for it. So you can close your eyes, or if you feel like, you can gaze into the screen, which has a beautiful scenery of sunrise. Focus on your breathing. As you're focusing on your breath, take a deep breath through your nose and exhale through your mouth. Let's repeat this cycle for 3 times. Inhale, exhale it through your mouth. Inhale last time. Exhale through your mouth. Now you can get back to your original way of breathing. Let it follow as per your body rhythm. But focus on your breathing. Notice how the inhale is different from the exhale. You may experience the air as cool as it enters your nose and warm as you exhale. As you turn more deeply inward, begin to let go of noise around you. If you are distracted by sounds in the room, simply notice them and then bring back your intention back to your breath. Simply breathe as your breath, not striving to change anything about your breath. Don't try to control your breath in any ways. Observe and accept your experience in this moment without judgment, paying attention to each inhaling and exhaling. If your mind is wandering to the thoughts, plans, or perhaps problems, simply notice your mind wandering. Watch the thoughts as it enters your awareness as naturally as possible. Then practice letting go of the thought as if it were left floating down sorry, as if it were a leaf floating down a stream. If your mind places each thought that rises on a leaf and watch it as if it floating out of the sight down the stream. Then bring back your attention to your breath. Your breath is the anchor you can return to over and over again when you become distracted by thoughts. Notice when your mind has wandered. Observe the types of thought that hooks or distracts you. Noticing is a rich and a beautiful part of learning. With this knowledge, you can strengthen your ability to detach from thoughts and mindfully focusing your awareness back on the qualities of your breath. Practice coming back to the home of breathing in full attention. Watching the gentle rise of your stomach on the in breath and relaxedly letting go on the out breath. Allow yourself to be completely with your breath as it flows in and out. You might become distracted by the pain or discomfort in your body, or twitching or itching sensation that draws your attention away from the breath. You may also notice feeling rising, perhaps sadness or happiness, frustration or contentment. Acknowledge whatever comes up, including thoughts or stories about your experience. Simply notice where your mind went without judging it, pushing it away, clinging on to it, or wishing it were different, and simply refocusing your mind and guide your attention back to your breath. Breathe in and breathe out. Breathe in and breathe out. Follow the air all the way in and all the way out. Mindfully be present moment by moment with your breath. If your mind wanders away from your breath, just notice without judging it. Be it a thought, emotion, or sensation that hooks your attention, and gently guide your awareness back to your breathing. As this practice coming to an end, slowly allow your attention to expand your notice, your entire body, and then beyond your body to the room you are in. When you're ready, you can open your eyes slowly and feel the present moment. Great. I guess you guys have given a good 5 minutes of time to notice on your breath. In fact, I would like to tell you the story, and most of you have heard about it, that during this COVID scenario, a older woman told when she was supposed to be in the ventilator, she told that this many years I have been breathing and I haven't noticed. However, now for last 5 years, I have to be in a ventilator and pay some around a lakh for getting my breath back. So you should be very grateful for your breathing, smallest activity, right? Okay, so this is how a mindful activity takes place, but I just did it for 5 minutes and it was quite fast because of the time purpose. I have did it faster. So what you can do is you can download certain free apps are available called Mindful with Petit Bamboo, or Mindful app, or Calm, which is available in Android and even iOS. So get onto this kind of enroll them in this kind of activity, so that if you could do it every day, as I said, it has to become part of your life. You're giving some time for yourself, which would help you to uh, you know understand your thoughts and your emotions and where you're going wrong, and you can focus better what is your dreams and plans about it, so that you don't get distressed, right? So the whole agenda is you should avoid chronic stress. Stress is part of our life. I'm not saying you cannot be without it, but you can manage it. That's what the whole talk was about it. And that would help you to enhance your overall well-being, your health, your emotional aspect, your social aspect, your spiritual aspect, which all would come together and you will feel better. See, some of you don't want to get into our app. You can also go to the YouTube and type on mindfulness activity. You do get it. And many hundreds of videos are there. You can follow them. So with this, I conclude my talk. Thank you very much for listening to me.